Dear boomers, today we will be discussing several medical practices that have been re-examined by the medical community, from thickened fluids that are recommended for dementia patients and to spinal implants for chronic pain. These procedures are being questioned for their effectiveness. So for years, patients with dementia who have trouble swallowing have been prescribed thickened liquids. The idea is that thin liquids can be aspirated into the lungs, causing the complication of aspiration pneumonia. A recent large-scale study from the Feinstein Institutes for Medical Research has cast doubt on this practice. So this particular study looked at 9,000 older patients and found no significant difference in health outcomes between those who drank thickened liquids and those who did not. In fact, patients on thickened liquids were more likely to develop pneumonia, and the practice often impacts their quality of life negatively. Another common practice is stopping blood pressure medications, specifically ACE inhibitors and ARBs, before surgery. Doctors worry that these drugs may cause a dangerous drop in blood pressure during surgery. But what does the evidence say? The most recent research shows that continuing these medicines may pose no additional risks. A study involving over 2,000 patients revealed no significant difference in complication rates, whether they stop their medicines or not. It's a good reminder to have a detailed conversation with your doctor about your medicine before surgery, particularly high blood pressure medicines or any of the other medicines you may be taking. And in some cases, I wonder if the elderly people are being prescribed too many medicines that contribute to dementia states. And I know that there are several cases where when the doctor strategically goes over a medication lists, removes some that really aren't doing much good, that person maintains more clarity in the way that they live their life. So let's discuss spinal implants for chronic pain. Spinal cord stimulators, they're called, which are implanted to help manage chronic pain, is another common treatment. But does this technology really work? While the technology has been advancing, studies show mixed results. A new study found that many patients still rely on opioids and other pain treatments even after receiving the implant. 1 in 5 patients needed further surgery to adjust or remove the device. Doctors urge patients to be cautious. If you're considering spinal cord stimulation, it's crucial to undergo a trial before committing to the full procedure to see if it offers any meaningful relief. As you can see, even long-standing medical practices can change when new evidence comes to light. It's important to stay informed and have open conversations with your healthcare provider about treatments that work best for you. So if you have anything that you would like to add to this, or if you have been part and parcel of these treatments, give me a comment below. And I did mention before that I would put a link to Dr. Gundry's vitamins and his supplements, and if you order from my link, I believe it's a 30% discount, but I will take another look at that. I think as elderly people, what happens so often is we visit the doctor time and time again, and we can't really get on with a state of flow in our lives because we always have these doctor's appointments. Now, of course, if you have an appointment for a chronic condition or if you are ill, that's a different story. But I remember going with some friends to the beach. These people were older, and when we got there, they unloaded all of their medicines and put them in the medicine cabinet, and there was an overflow and it covered the whole sink. And I thought to myself, are all of these medicines really necessary? And I really, at that point in time, began to think that we need to, as patients ourselves, as consumers of the medical practices that we are given here today in this country, we need to question what we are putting into our bodies. And it could be that some of these things are not helpful. Some of these things might be contributing to a sluggish feeling throughout the day. And in fact, when my husband had his first heart attack back in 1994, he was prescribed a whole host of medicines. And I remember him lying on his back, completely downed out, and not in a good way. He said, if I have to do this for the rest of my life, I would rather die. Well, fortunately, they diagnosed him in a different way a little later by a controversial diagnosis at the time, which was called hyperhomocystinemia. And it is probably, it's a condition that runs through the Irish population. And he is Irish, he was. And most of his relatives died at a young age from probably what was hyperhomocystinemia. The treatment for that, he could get off all of his medicines, were all the B vitamins, B2, B6, B12, and we got a little bit of we got a pill with all of these things in it, and he was able to take that, and he did, and it did prolong his life, I'm pretty sure. But he had 3 heart attacks, and the 4th heart attack was where COVID took over. You know, COVID had a weakened, if somebody had a weakened condition, COVID was more easily able to latch on to that person. So that is my little spiel for the day. I hope everybody is well. Come on over here and look at the next video, and bye-bye.